Today we're going to be presenting an amazing team here, specifically with the focus on nutrigenomics, dietary changes, and functional changes, along with the dynamics that affect breastfeeding. Okay, so we're going to be doing a presentation for the purpose of understanding breastfeeding and how it affects mom and child, specifically in the formative years. Today, we got a team here with Ana Paola Rodriguez Arciniega, who is a master nutritionist who has formulated a presentation to discuss the issues of breastfeeding, particularly how it affects children at a certain age through the birthing process. And we're going to get some insights as to how we can improve the particular aspects of breastfeeding. Now, we all know that we have heard from different groups that, as well as the science, and a lot of science is based on nutrition during the pregnancy, after the pregnancy is very important, specifically from the breast milk to maternal feeding. So how does this relate to a musculoskeletal system? It doesn't, not too much. But what we're going to be doing is we're going to be understanding that how we prepare a child early on will definitely affect the future biochemistry of the individual. So it's important to start off on the right foot. So today I'd like to start by presenting Ana Paola Rodriguez Arciniega, the master nutritionist. She's going to do a presentation. We're going to add information, and we're going to have enormous kind of show and tell today. I won't leave it kind of figure that one out, because we're going to have some real information specifically about breastfeeding and the dynamics as to the expectations of a new mother, and to see what actually happens, and bring some real basic take-home bits of information for you and your family. So Ana Paola, tell us a little bit about what you're going to be talking about today. Go ahead.
Well, hello. First of all, thank you for being here. And today we're going to talk a little bit more about the fundamentals of breastfeeding and how it should start and why it has that tremendous impact in the life of babies. And it's mainly because I really want to dig into the nutritional components of breast milk. And you will find this out, that those nutritional components actually are immunological factors or bioactive components that eventually start to impact very, very tremendously in the life of an infant. So it eventually would have an impact between the mother and the child, and there's a communication, and there's a lot of information. So I really want to stay in the introduction part of it, but I really hope that this could be very insightful for our audience, and for them to really know about a little bit more about breast milk and a little bit more about breastfeeding and its benefits.
Excellent. You have a presentation for us, and tell us on a brief note, Kenna, what you're going to be able to give us a prelude as to what you might be discussing today.
Yes, I will be talking about the Montgomery glands that we have, the child's stomach size, some of the genes that go into it, and also be able to show a little bit of examples.
Excellent. All right. So take it away, Ana. You go ahead and do a presentation. As your presentation comes up, I want you guys to know that we're always available. Our phone number is 915-850-0900. Call us in the event that you have questions for Ana or for Kenna at any given time, because what we're going to be able to do is to formulate a team that's going to be able to discuss specific questions. And obviously these matters are private and they are very specific to an individual. So you have a forum, and we are here to be able to go over those particular dynamics. As we prep here, what we want to do is we want to be able to see that as we see the connection, our goal simply is to bring the basics understanding of nutrition, the nutraceuticals, the nutrition into the forefront. So today we're going to begin by understanding what is breastfeeding. So Ana, are you ready?
Yes, I'm ready.
Go ahead.
Well, first of all, I would like to make a disclaimer, and I would like to tell you why am I doing this, or why did I choose to continue my education with breastfeeding or lactation information or education. Well, first of all, I have to say that I wasn't breastfed. I have never, I don't have kids, so I obviously have not breastfeed anyone. So this eventually it started when I was starting my private practice. I really found I started working with a doctor who was a pediatrician and an immunologist. And he just found me in the, it was really funny because he actually found me in the parking lot of the hospital where I was working in. And we started talking and he went like, okay, you're a nutritionist and I need a nutritionist because I'm going to send you all of my patients and you will find out that maybe the patient will be the child and you have to assess the child, but the real thing is that you have to heal the mother and the family and their parents because they are really nervous about what is going on with their child. So, man, I just started reading through all of the information about allergy and the nutritional treatment of allergy. And it's really funny because I was, as I told you before, I wasn't breastfed and I had to go through all of my life with bursts of eczema, which are actually very violent when they come through. They actually look like a psoriasis or something like that. It's so difficult for me to handle it. So I was going through all of this information about allergic reactions to food, and eventually all of the assessments came down to breastfeeding. And I was like, what is this information all about? I couldn't get it at the beginning. And I figured out that I needed more information about it. So if I could fast forward to like a month later when I first had my first encounter with this patient, which is not actually a patient, as I told you before, you assess the child, but you talk to the mother. So you're actually healing and treating the mother. So I was talking to her and really her hair was like this. She was going nuts. She was going crazy. She just came from the appointment with the allergist, and he told him like, here is the recipe. You have to lose all of these foods, and you have to go to a nutritionist. So eventually, when they came in, they were bursting into tears. They were going through all of this. It was like a very intense guilt trip, but I mean, you're there to help, and I could actually see myself as the child and the mother of the patient as my mother because it was exactly the same thing. I was that kid that would eventually have to be in a lot of doctor appointments and hear my mother said the same things that these mothers would say to me. And I thought like, okay, I need to help this. And okay, food allergy is not easy to assess. It's not easy to treat, but it's treatable. I mean, you can have a normal life if you didn't fully start with the breastfeeding process correctly while you were in the lactation period. But nevertheless, what is the first thing that we need to treat? We need to treat upstream. So the first thing that I noticed is like, okay, these people are sending me not only their food allergy patients, but they are actually sending me pregnant women so that I could teach them how to lactate. And that is not easy. And that is bioethically kind of difficult to teach. So I figured out this is what my population needs. This is eventually what I'm seeing right now. And I need to get on it and I need further information. So I kind of started like going this way into a very kind of food allergy related situation and the breastfeeding situation. And eventually I had to start reading a lot about breast milk and what was all this fuss about breastfeeding. And I think it actually had to, well, as I told you, a lot of patients started coming in and they were like pregnant ladies and they were going crazy about breastfeeding information. And it actually related to this picture of an actress breastfeeding her child, and I don't remember her name, but it was like really popular at that time, and that's where I said like, okay, this might be a fashion, but it's really important. So that's why I'm here. Even if I wasn't breastfed, even if I do not have kids, this is kind of my niche. This is where I feel comfortable. This is what I like. So yeah, let's just start with what is breastfeeding, because it's actually really interesting.
Anna, as we discuss this, what we can see is that it's real. It's real. You're bringing it home to us. You're a real individual. And what we want to do is we want to reach back and talk to real people. So I'm really excited to see that your story is very endearing to all of us. And I want to go ahead and start and tell us what we're going to learn now.
Well, I would like to start talking about breastfeeding, but actually breastfeeding it's an action, and it comes right after lactation, because lactation is like the biological process that allows breastfeeding to be possible. So I first would like to say that, did you know that us human beings are like the smallest mammal alive? We're only like 30% mature when we are born. We're like unsuitable for life. We can talk, we can't communicate, we are loud, we are immature, our gut is immature, our surface is immature, everything is immature about us. So actually lactation is part of the evolutionary process. What happened? Well, what actually happened is that we are born, we're so immature, and this lactation process, this 6 months of lactation or 2 years of lactation or 3 months of lactation are our continuation of like the developmental process that we have to go through in order to achieve that matureness. So that is actually what breastfeeding is all about. It's that continuation of the development inside of the womb, but outside of it. So it has like a very specific function of providing us the right nutrition, kind of what blood would be like if we are inside of the womb of our mother. So that is actually something that really speak up to me when I talk about breastfeeding and about breast milk, is that you cannot take it for granted. And I would like to go back to Kenna and actually ask her, what do you think about this? How are you feeling now that you are breastfeeding and that you already breastfed your firstborn child?
Yes, so I definitely know where you're coming from as far as a mother's standpoint goes when you see them. With my son, he was so colicky and constantly screaming. You know, all he wanted to do was eat, throw up, eat, throw up, eat, throw up. And I was at my wit's end. I'm sure my hair looked just like the patient that you described. And I took him to the pediatrician, and all she said was, you know, it could be a reaction to eggs, milk, peanuts, fish, or soy. And then she left. And then I just cried because I was like, what am I supposed to eat? Like that, I don't even know what to do. So we went to a lactation consultant who is also a nutritionalist, and she really guided us through that whole entire process. And it's so, so helpful. So I do just want to start out by saying that if you are breastfeeding or thinking about breastfeeding, you should definitely reach out for help. It's nothing to be embarrassed about, because even though lactation is normal, breastfeeding doesn't necessarily come naturally. Yes. And there's a lot of problems, even with the latch, with oh my gosh, the list goes on and on and on forever. So breastfeeding is super, super great if you're able to make it work for you. Even just a child breastfeeding 1 time a day or having 1 bottle of breast milk a day and the rest be formula has shown to have benefits on the child with their genetics and with their immune system. So even if you can only do 2 ounces or 5 ounces or whatever anything is better than none. It has so many great properties, which we're going to talk about today. And I also did want to talk about another thing really quick is breast milk is actually made from the blood, not from the contents of your stomach, which can get kind of confusing. But Dr. Jimenez had said that it doesn't have much to do with the skeletal system. However, children do need vitamin D, and they don't really go outside a lot as babies. And everything that the child gets is from us. So that child actually takes the vitamin D from me. So I need vitamin D for my bones. So it does kind of eventually all come hand in hand so that my bones don't get brittle and weak. So there's also there's supplements that can help your milk, that can help your baby, that can help everybody get all the nutrition that they need. So wherever you want to start on it, I'll go ahead and follow behind.
Okay. Well, that's actually very, very important information. And as you said before, lactation is natural. We think about it as a natural process because a lot of hormones have to come together for us to be able to lactate. Even the anatomical, well, obviously the anatomical parts that are involved in breastfeeding are the breast. So the anatomical differences from each different breast or the development of breast tissue can actually affect how you are breastfeeding your children, or if you're going to be able to breastfeed your children. So it's really, well, as I told you before, we're going to talk about all of these amazing benefits of breast milk. And I don't want people to feel guilty about not being able to provide enough supply of breast milk. Because there are like different options that are not like the same, but that can actually work. And as you said before, there are a lot of supplements. If you're not providing the best nutrient intake, like the best nutrients, the best energy intake through your milk, well, then think about supplementation. Go to a professional to get more information. Just look around. There's always an option for it to work out for you. So yes, we're gonna start right here in breastfeeding because we already talked about lactation. And we just talked about the introduction of lactation because, as I told you before, you have to go through all of this hormonal process, and oxytocin plays like a very important role right here when you're trying to get your milk supply to flow and the milk ejection process, and it's complex. So yes, lactation might feel or might be natural, but it's not simple. It's not easy. And it's our job as health practitioners, as nutritionists, to be able to provide enough information for our patients for them to continue or chose not to continue with breastfeeding. So yes, as I said before, we are part of a community here, and there's something very, very like important with breastfeeding. Breastfeeding should be supported by the family members, should be supported by the community, and it should also be supported by the governments. And by this, I mean that there are a lot of places where you can find a specific place to nurse your child, or even take out time of your workday to be able to hand express milk from your breast, or maybe just go home and feed your baby. So there's a lot of things that we can do to support breastfeeding, but I think that right here in this particular moment of our lives where we are like kind of segregated because of the pandemic, webinars, podcasts are really helpful for the fulfillment of the lactation period of a child. So do whatever you can to just support breastfeeding. I think that's like the best way you can possibly go. So another thing is that breastfeeding is the gold standard and is like human specific. So yes, we can provide milk. We can drink cow's milk. We can drink goat's milk and even almond milk and everything milk. There's like all kinds of milk. And yes, you can have it, maybe not in the first 6 months of life, but breastfeeding is like the best nutrition that you can give to your children. Yes, right. Another thing is that it's recommended by the World Health Organization, and it's recommended to be exclusively breastfed through the first 6 months of life. So that is like really, really important. But as Kenna said before, if you're not able to provide uh, 8 bottles of breast milk or breastfeed your baby for 6 hours straight, well, just give 1 ounce, give 1 or 3 ounces. It doesn't matter. Just try to hand express, try to have your own milk bank, because that's like something really important too. Just try to breastfeed your baby. I would actually like for Kenna to explain a little bit more about the benefits of breastfeeding and the benefits for the mother or the parents that breastfeeding can provide to the family.
Yes. So what breastfeeding can do is it definitely helps strengthen the bond between the mother and the baby, because even though you have grown this child for 10 months inside of you, when they come out, it's not always a natural connection. My son went to the NICU right away, so I didn't even get to see him or hold him. And I remember the first time that I saw him, I didn't know what to say. I just was like, "Hi, I'm your mom." Like, it's not always natural. So what you need is it really helps with that connection to get to know your baby and things like that, as well as it lowers the mother's risk of breast cancer and ovarian cancer. It also helps with postpartum depression, helps it keep it at bay because you're still producing hormones. Versus if you formula feed, your hormones diminish a lot faster. And this kind of, it can rock your world because you've had 10 months. Sorry, we're playing dinosaurs. 10 months to build up these hormones, and all of a sudden they just leave. But if you're breastfeeding, you're still having that surge of oxytocin, which really, really helps. So that can help keep your postpartum depression either non-existent or really, really at bay and mild until you decide to eventually wean. It also helps with osteoporosis, and it helps your child develop a less chance of getting diabetes and cardiovascular disease. Additionally, producing breast milk burns 500 calories a day. So it's also nice for weight loss when you are trying to get rid of your baby weight. And it also can be easier on the family to go anywhere, go out in social outings, because you're not so worried if you have milk or who's going to feed your baby, because it's always there. And it's actually legal now in all 50 states to breastfeed in public. So even though it is very, very nice to have a private room, if you're not comfortable with that, you can wear covers or anything, but you can breastfeed anywhere now, which is super amazing because a while ago that was not a possibility. And it is definitely less expensive. It is relatively free. All you have to pay for is, of course, like a breast pump, which most insurance covers. And but other than that, like formula is anywhere to $200 to $400 a month, depending on the type that your child would need.
Thank you. Thank you so much for the information. Another thing, while you were talking about breast pumps, is that you can find them in every price, but actually, like a medical breast pump can be provided by your physician or through a lactation consultant if you are able to have that service. And most of the hospitals have that service now. So it's kind of, I'm not going to say easy because I haven't gone through that process, but it's something that is feasible. You can do it right now. Another thing that I think is really, really important is that like formulations have not been able to fully provide all of the bioactive components of breast milk. So yes, they have eventually changed. They are better now than they were before. But yes, the the cost of it is very, very expensive, and you can lower your cost by actually providing breast milk, and it's like a very good thing to have. Well, we're going to go into the benefits for the babies. Thank you so much. So right here, it's actually like the other way around. The same way that mothers bond to their babies, babies are going to bond with the parents. And it won't only be the mother, because right now, well, I don't know. Well, I know men can't breastfeed, like properly breastfeed their babies, but they can actually provide a bottle of breast milk and feed their babies. And it's actually better if they are not wearing any kind of clothes right here in the chest area, because that's the way you can actually provide a little bit of your microbiome. Like your skin microbiome is actually very important for your child to have. And that's like another way that fathers can actually bond with their children while they are providing milk from a bottle. Okay, so that's like a nice thing to have. As I said before, breastfeeding should be supported by everyone, and the father plays a very important role right here. Another thing that I talked about is the microbiome and the enhanced immunity. As I told you before, it's not only the breast milk that provides this immunity benefit to the baby. It's actually the skin to skin contact with the baby, even if it is from the father of the baby or the mother of the baby. And it is actually the way that the baby is born into this world, because you can have C-sections and you won't have the same amount or the same microbiome going through that C-section birth than if you go through the natural birth canal. So that's actually something that we have to take into account when we talk about the ear infections or the asthma or the sudden infant death syndrome that sits. So that could actually happen, and we can lower the risk by a lot of factors, being breast milk very important factor, because I mean, sometimes you need to have a C-section, and I'm not going to judge. So yes, you can actually provide immunity while taking your baby and having it skin to skin, or either providing the largest amount of time of breastfeeding sessions. So yes, you can do that. It has actually shown to lower the risk of diabetes. It has also shown to have or to benefit the children in the fact that they can have higher IQ levels. And here we go again. Yes, breastfeeding is actually linked to that, but you can actually provide that same amount of DHA levels, because that's where the association is really at, by providing a formulation that is high in the levels of DHA. So that's actually something that you can provide to the children if you're not able to provide breast milk. As I talked to you before, healthy microbiome also comes from breast milk, but you can have it other way. And also there are a lot of formulations right now that can provide human milk polysaccharides. We're going to talk about them later. And they can actually improve the microbiome health and the microbiome structure of your baby. So tell me, Kenna, do you want to add something more to this, something like in a more practical level, since you are the one who's really seeing all of these important benefits?
Yes. So I had 2 C-sections with my children. I am type 1 diabetic, so that is the option for me. And it does definitely play an effect with the, like my son has eczema flare-ups, but since he had breast milk, it's not to the extent that it could have been. Also, skin to skin, like you had said, is super huge, and it also helps your milk come in. When your baby is born, you don't have mature milk. You have something called colostrum, which comes out in very, very tiny drops. However, the first day that your baby is born, their stomach is only the size of an apple seed. So they don't need milk. They need that colostrum. It's also known as liquid gold because it's very, very dark yellow and almost orange. And this is what provides the most nutrients for your child. By the end of your child's first week of life, their stomach is already grown up to the size of an egg. And so this is when you start to see your milk come in. Typically for C-section mothers, it's a little bit later, around 4 to 5 days. And so when that milk comes in, then that's when you just need to follow your baby's cues. With formula-fed children, they tend to eat every 2 hours, 3 hours, 4 hours, however long as they grow, because the calories that they need, they start taking in more ounces, versus breast milk changes per the individual. So a breastfed child will never really take more than 4 to 5 ounces of breast milk at a time and still get the same, if not more, nutrients from a baby who has 8 ounces of formula at feeding. So it's really, really important that with breastfeeding, you follow their feeding cues.
Yeah.
And one thing that helps with the child's first latch is the Montgomery glands. These are on the breast, the areola, and everybody has between 8 to 32. So it varies per individual, but they help to lubricate so the child can eat better without causing pain to the mother. And they're also, so that's part of the sebaceous glands, but they also have been studied and have found that they give off a similar scent as the amniotic fluid that the child was in inside the womb. So it draws them to that because that's something that they are very familiar with since they are born. There's a whole lot, their whole world just changed. So that's why we provide a scent that is very similar to what they had inside the womb. And as we latch them more, that's how your milk grows more. And this is the same gland that the child's saliva interacts with. It's kind of like a two-way street. So we submit the oils out and their saliva goes in, and that sends the response and tells our body what nutrients they're lacking and what nutrients we need to make more of in our milk. That way the child is actually meeting the nutritional needs and developing the antibodies. For example, if your child is sick, your breast milk will look different than when your child is healthy. So a few weeks ago, both of my kids had a cold, just your typical runny nose, a little stuffy. You could hear some congestion. And so it's amazing how much my milk changed. And it became more of a yellow color because it had more of the antibodies in it than my healthy regular milk. So when your child is sick, you really want to use that fresh milk, not any milk that you have stored, because you want them to get those antibodies in. And I am currently breastfeeding my 5-month-old, not my 2-year-old, but when he was sick, I would pour a little bit of my pumped milk into one of his cups for the day so that he was still getting those antibodies because they were fighting off the same cold. So it can help both children if you're in that kind of area that you can do that. It's super great because the natural weaning age is actually 3 to 7 years old. So I did wean him around 12 months, but when he's sick, will still provide a little bit of pumped breast milk to him to get those antibodies that he needs to help fight his colds faster, since I'm producing milk for his sister. So that's things.
One of the things is that I know this is a very unique time for you because we have props here to see. And I know that we have the opportunity to not only experience with you what it is for you, the breastfeeding dynamics, but you can also present something that is very unique to let a lot of people have the insights as to what to expect and see what to kind of see during those period of time. So do you have anything to show us there?
Yes, so I took out some of my milk that I had pumped from when my kids were sick. It has thawed out a little bit now since I have pulled it out, but it is more, it's kind of hard to see with my lighting. It looks a little more white, but there is more of a yellowish tinge to this milk versus my freshly pumped milk. It's very normal for your breast milk to change colors. It can even be a green tint if you have eaten a lot of vegetables. So blues, greens, all of that is normal, even red occasionally because some blood might get in your milk from pumping or agitation, but all of that is completely normal. And then I also did want to show the difference of freshly pumped milk. Since it is milk, it does separate, which is also natural. So I wanted you to be able to see the different components of the milk. So if you look closely, you can see that this top line is really very thick, and that is the fat layer that my child needs. The rest of this is almost clear. It kind of looks like water. This is hydration. So when she needs more fat, there will be a thicker fat layer versus when she needs more water. Since I live in Texas, it's not very hot right now, but it's normally hot. So in the summertime when she was born, you would see a very thin layer of fat and a lot of this milky like watery residue so that she can accurately get the hydration she needs, because children do not drink water. They just, like Anna was saying, the first 6 months is just breast milk. So they get everything they need from this. And then if you just shake it up before you feed your child, and it all just comes all together, and then it's ready to be warmed up and go in the fridge or in their bottle, whatever they need. So it's definitely cool to see that separation. You can also tell this was in the morning time, so it has more of that hydration factor because she does not eat at night anymore. So when she wakes up in the morning, she needs a lot of water essentially because she hasn't had any all night, and less fat, versus before she goes to bed, my milk is very fatty to keep her full and sustained throughout the night. So that is also very cool. The milk at night also has more melatonin in it naturally, so that the children will sleep more for longer amounts of time. So not only does the fat level change, but also those smaller chemical compounds in it also change, which is really crazy if you think about it, that the human body is able to do that to provide for them. Because as Anna was saying, we are not mature at all when we're born. We can do nothing but cry for something that we need. So in order for the human body to cater to the needs of our children like that is something that is very, very fascinating to me.
Oh, thank you. That's like very important information. And I think that could actually can relate or can be linked directly to the fact that our genetical structure is going to be changed, or it's going to be stimulated by the signals that we provide with our nutrition. So if eventually we're drinking breast milk and this breast milk provides melatonin, then I'm going to have a normal cycle of sleep, which I was really lacking when I was a little baby, because I was crying a lot and I would be like awake for the whole night. I won't do any noise. I mean, I was a very calm baby, but I wouldn't sleep at night. So that must be like very hard for me at the beginning. But yeah, I really do think that the genetical studies will have to go a little bit deeper into that. And I actually I remember reading about the melatonin effect, the circadian rhythms, and the metabolic disease are completely linked one to another, in the fact that that is one of the mechanisms that could actually provide a prevention to diabetes or metabolic syndrome or even overweight. So I think that is really important to link and to know about breast milk. So that's like really important information. Another thing that I would like to ask you is, the difference between foremilk. The foremilk is the milk that you're able to provide your children at the beginning of a session, and the hind milk comes a little later on, right in the last part of your breastfeeding session. So it can actually differ from the components, from the nutritional components. Have you noticed that too in your breast milk? Because I saw the different components of your.
Right. Yes. So the foremilk comes out very fast in your first letdown is what they call it. You can have more than one letdown throughout a feeding. It is designed to come very quick because children are hungry. So if they start to feed and the milk doesn't come, they will get very frustrated. So that foremilk is usually just right there, ready to go. And it's more watery, more clear, more liquidy, versus that hind milk, which is pushed up further in the breast. So once they have extracted all of the foremilk, the hind milk comes in, which is more of that fatty layer, which varies from child to child. And one thing that is also very interesting is you can tell if a mother has a foremilk to hind milk imbalance in the child's diaper. The child's stools will be green and foamy if all they are receiving is that foremilk and not enough hind milk. So one thing, if that's happening, is you can pump a little bit before you feed your child. That way there's still enough foremilk for them to get right at the beginning, but then they have that hind milk in the back. So it's often a struggle for people who oversupply, because newborns, like I said, their bellies are so little that they often fall asleep after 5 minutes of eating. And then the mother is just sitting there, spraying milk everywhere because the baby didn't get fish and they didn't get that nutrition that they need. And a lot of times breastfed babies will have a slower growth rate because they are only getting the nutrition that they need, versus formula babies are always fed the exact same amount of calories per bottle. And so they might be getting more nutrition than they need at certain periods of time, which is why formula has also been not linked to being overweight, but breast milk has reduced the chances of children being obese and having metabolic syndrome, because they follow their cues when they stop eating when they're full, versus formula babies tend to finish the bottle whether they're full or not. So it also teaches them kind of early on when they're full and satisfied. Right. And you can also tell when they're full, because a newborn, when they're hungry, their little fists will be really clenched. And once they've gotten all that full milk, their body relaxes and their hands open. So that's another way that you can tell that your child is getting full, as well as the amount of wet diapers they're having throughout the day.
I think that another benefit of breast milk for the mothers is that you are a little bit more aware of the cues of your baby, because you're close to them and you know exactly what kind of like little face he or she would do if she was like being hungry or anything. They start being fussy, and it's too late by that time, because you now have to deal with a baby who's angry, so you have to calm them first and then feed them. And it should be like the other way around, because they're actually mad because they are hungry. Right. So I think that by providing breast milk, you're actually like stepping away from all the drama. So that is actually like a good benefit that you would like to have right after you are like pregnant and everything. Like, peace. I know what you want. You want to eat, you want to sleep, or you want some cuddles. So
yes, definitely.
Or a diaper change.
Yes, I've noticed that there is a little bit in my children personally. Their feeding cues are different. My son did a lot of bottles of breast milk, so his feeding cues he would just start to eat his hands, because they kind of felt like a bottle nipple, versus my daughter will just start trying to eat like a shoulder or an elbow or anything that's skin feeling.
Resemble.
Yes.
Okay.
Versus my son would go for more like the pacifiers and the plasticky things, because he was used to a bottle versus
a bottle, right?
Skin. Right. So it's definitely, it always changes per child, but there is differences. One reason that I also like breastfeeding is because breast milk has a lot of epithelial cells in them, and those epithelial cells do contain RNA and DNA, which make up 50 to 90% of cell types that are found in the breast milk. So that is also a great way to understand the mechanism and the variability that we have in our breast milk for our children and what they need and what we are passing on to them.
Oh, that's great. So that actually, I think that associates with this next topic that we're going to talk about, which is like the amount of breastfeeding that you have to be able to provide to your children. So as I said before, it is recommended that we breastfeed our children for at least 6 months. Like the first 6 months should be exclusively lactation and exclusively breastfeeding. So this is actually a systemic review about all of the different research that has been done around the specific duration of lactation and what were the benefits, and does it really have to be like 6 months or not? So they actually concluded that they needed to be 6 months exclusively just to have the benefits. And they found that there are like a lot of benefits and a lot of applications that you can provide, or that you can provide breastfeeding benefits. So one of them actually talked about how 3 months of breastfeeding can provide benefits to those patients dealing with eczema, or how can it actually can inhibit the eczema symptoms. Another one said that this was funny. They said that exclusive breastfeeding had no benefits at all. And then in the conclusions that said like, well, that's not true. And his conclusions, or the specific conclusions of this study, were not really true. So we're going to take that out. So I thought that was amazing for them to conclude that. So eventually they are still recommending 6 exclusive months of breastfeeding, and that is really important to note. But as you said before, the weaning period of a children must be right after the 3 years, and by that we mean that he should be completely included in the family diet by the age of 3 years old. But there is like something funny about that, because they actually have to cross over the 2-year mark. That's actually the terrible twos, when they can say, no, I don't want this, and they can actually make decisions. So that's like a big part of being like a mother, I think. Like the application of the nutritional recommendations and actually what is going on in your house. Mm-hmm. So I found it to be important.
Right. And they do still, there's benefits for however long the child breastfeeds, because they're still getting those, immunization, like they're still getting all of the benefits of the breast milk. It doesn't change. It changes with the child, but it doesn't change from the health standpoint from it. And my son, he's 2 now, and he eats the family diet. And one thing that he always loves and comes up to me every single day, not with breast milk, but is with his vitamins. So that's another important thing that I take my vitamins every day, and now so does my son. And he comes up to me and he asks me for his vitamins every single day, and he loves them. They are super great. He uses the ones that we have in our clinic from Zymogen, and they are amazing. They're chewable and they smell delicious, and they help him to get what he needs, since he's no longer getting breast milk. And 2-year-olds, like you said, they can say yuck, they can say no. He starts to not want to eat everything. So I also think that it's important that we do vitamins as well.
Yes, that was actually one of my main concerns when I started providing nutritional treatment to my allergy patients, because you could you could easily think that the ones who are like 10 years old would be like the real difficult ones, but no, the really ones, the ones that I was really struggling with were the 2 years old. Man, they are something. They are magical, but they can say no, and they can actually put you like really in a, like, you need to think very well what kind of diet you're going to provide that child, because it's difficult. It's very difficult. So, yes.
Things that you had mentioned in this process. And as you can see, that the process of only being out a moment where it's only for a certain window of time, that appears to have been extended now to 6 months. And I see that now developmental issues such as feeding the child, actually the development of the intestines in the process of the immune system, the brain system should be extended longer. That was a component that when we were younger, or many years ago, you see that people would stop weaning at 3 months. So let me ask you this: what have we learned by extending it for 6 months?
Well, something that we have to consider is that nutrition is it's like fashion. It changes. And whatever it is that it's going on in either in research or in the industry, it's what are you going to be able to take or to buy or to provide to your children. And most of those, how do you call it? Merchandising, propaganda are directly focused on children. So, yes, I think it has a little thing to do with that when babies or children are able to make their own decisions. But you as the parent have to need to have a lot of information about what you're going to provide nutritionally to your children. So yes, now that we know all about the microbiome, we can know and we can be certain that there will be some formulas that would provide either human milk oligosaccharides or different strains of bacterial strains that would actually provide health benefits to our babies. So yes, I think you have to see through all of the mystical thing, or not the mystical, like the fashion sense of what you're going through with nutrition in order to fully provide an answer to that question. So yes, and for that matter, I think that we should be concentrating in the nutritional components that that human milk can provide. Because the thing about breast milk is that it is actually made to provide energy. As Kenna said before, breast milk has a little less energy or less caloric, energy than the formulas. So that's something that you have to take into account. But it is actually one kind of like non-linear tissue that will change. It will change depending on the information that our Montgomery glands are going to receive. What does the baby need? So yeah, that's the way that human milk is like modifiable in that sense. So the first thing is, yes, breast milk will provide energy. Breast milk will keep your baby alive just by providing energy. That's something that we have to take into account. The other thing that I think that actually Ken already mentioned is that the lipid profile or the lipid concentration of breast milk, it's going to change, and it's going to change depending on what our baby needs. For example, a preterm baby will exchange this kind of information with the Montgomery glands of the breast of their mother, and then her human milk will change, and it will provide a bigger concentration of lipids and a little bit of more energy coming from triglycerides or, well, lipids in general. But triglycerides are like the thing that we can mostly find in the lipid content of human milk. Another thing is that actually protein can actually change a lot. And the thing or the difference between protein content in human milk and the protein content of formula is that formula has a lot of protein. So that's actually something that contributes to the higher energy intake that a formula fed baby is going to get from the milk that it's provided to him or her. Another thing is that the lactose concentration will be like very standard in the human milk, and thankfully this is like one of the subjects that has been able to change in the formula world, because now we're able to provide microbiome, not microbiome, but we are able to provide bacterial strains that can provide health benefits to the baby via formula. And we can also provide human milk oligosaccharides, which is a part of the lactose component of the milk, either human milk or now formula milk. And this can actually provide prebiotics to those probiotics that are already included on the formula. So,
as you're mentioning that, Anna, I remember the time when I went to school. We were told that breast milk was, free of any sort of bacteria. We're learning so much more that now, from the moment the child leaves the womb to the first time they're exposed to the mom's probiotics, or at least their biome, human biome, that actually changes the dynamics of their microbiome and their gut biome. So breast milk also, we've learned that contains certain probiotics. Kenna, you've got some, tell us a little bit about what you've learned in terms of probiotics and what you do with your children in terms of probiotic options.
Yes, so as we were mentioning earlier, the microbiome is so special and so unique to each mother and to each child. And so after having C-sections and not having them pass through the birth canal, they didn't get the same microbiome as they would have. So this is something that you really want to keep in mind when it comes to breastfeeding, so that they can establish that microbiome. So when they start solids at around 6 months, that they are able to better handle it, that they don't have leaky gut starting from such a young age, and that they need to have these nutrients. And once my son turned 1 year old and he was starting to wean off of that breast milk, he still needs to build up that microbiome. It's so important for health, to prevent diseases later on. So one thing that I do for my children, not yet my daughter because she's still little, but my son, is he gets a smoothie every single morning. You have probably heard us say before, from the kitchens to the genes, it's huge. So we do smoothies every single morning to make sure that we're getting vegetables and protein. And I always add in his probiotics. These are at our clinic. These ones are specifically for toddlers. So it starts around the age of 1. And what I really like about these is that it's a powder. So I can just toss it. I know it's white, so you can't really, it's hard to see, but it has like a little scoop in there, and you just put in 2 scoops into our smoothies every single morning. That way I know that he's still getting all of the essential things that his little gut needs, because as I said before, the 2-year-old diet, no matter how hard we try, is not always the healthiest depending on what they will eat that day. So I love starting out with our smoothies in the morning to make sure that we're really getting everything that his little genes need, because he's in such a critical part for development right now. So these are super great, and they have about 6 strands, which is really great for children. A lot of other over-the-counter probiotics that you see, they usually only have about lactobacillus and just 1 or 2. So these are super great. And then the next thing we do, I was telling you about his vitamins earlier. These are the ones that are the chewables for children ages 1, and adults can take these too if they don't like to swallow them. But they're super great for kids because they are berry flavored, and they do provide like I said, just more nutrients for him, since sometimes he only wants chicken nuggets.
Yeah.
So we need to make sure that we are also helping their little guts and everything so they can have proper development, so that they're not getting all those icky germs from daycare or school, and they're just able to fight it off better by protecting them from the inside out.
Yes, and that is actually very important that you mentioned, because well, going all the way back to my to my topic right here is it's breast milk. So actually, the most studied strengths in human milk are either Lactobacillus bifidus or Bifidus infantis. So those are like the main ones that are really, really studied. And now that what they are actually trying to do is to actually merge or link together which kind of prebiotic, it is that they need to actually grow and really colonize the baby's gut, because they have seen that when this colonization goes the way it should go, when it is like this symbiosis, everything is healthy, everything is balanced, it's very impactful for the pathogens to not thrive in that ambience, because it actually rises the acidic content of the gut of an infant. So it's actually it's going to prevent a lot of diarrheal conditions that are linked with symbiosis. So yes, that's actually what you want. And that actually associates very well with the theory that we as kids, we will always have this kind of like we're going to have gut permeability, and it's going to be like maybe just for a while. It's not like you're going to have it forever, but you can have it, or you can have it change in order for the symbiosis to work out for you and your baby. So yes, microbiome, the bacterial content of our breast milk is going to change and affect very tremendously the lives of our children. So this is very, very important. And I just wanted to make a connection for those who are struggling with why can't I provide lactobacillus for my children who has like an allergic reaction to milk. It's not properly milk. It's just like the strain that you need to make that symbiosis work. But if you give the probiotic, you need to provide the prebiotic for the probiotic to fully colonize. So it comes together. So I would like to really let people know that you need to have a prebiotic in order for something else to work. You have to feed that prebiotic. So that is really, really important for
the way I look at it many times is when you send your children to school, okay, they have a purpose, and you send them with food, and this is how they function.
Yeah.
Our probiotics produce enzymes, they produce hormones, they help with development, they develop our immune system. So it's wise to, at the early stage, to develop the system. Now, I know that you had mentioned to me, Anna, that children are born with leaky gut, so to speak. And as they work out of that issue, tell me a little bit about the progression of what is leaky gut, and a little bit. And if Anna, you want Kenna to go ahead and offer information there, we need to understand that our job is to develop the gut so that later on, as they become mature adults, they have the proper basis of the natural genetic biome inside the gut that is actually workable for their future. Go ahead and share with that.
Well, yes, that was kind of what I meant when I said that there's like this translational or just like transitional, better said, immatureness to our gut. So when Kenna says that Lincoln was the one having the problems with him throwing up and having like very bad gastrointestinal problems. That is precisely what we need to learn. And as parents and as clinicians, we need to know that we have to be very patient for that period, because it's going to be there, it's going to be present, and it's only for us to really provide that kind of treatment, or either patients that our patient needs. So yeah, eventually when well, as I said it before, from a lactation specialist point of view, what I would try to do is to provide a little bit more of human milk. And this essentially has to do a lot with the hind milk or the fore milk, because fore milk is the one that provides a little bit more of the lactose products in it. So between these lactose products, you can find the human milk oligosaccharides that can actually provide or end up being metabolized and fermented by the microbiome that is already colonizing our baby's gut, and can provide that help that we need in order for pathogens such as E. coli for not to bite into our epithelial surface and eventually cause a problem with that intestinal permeability. So yes, that is like really important. So how would I do that? Well, eventually I would have to like make a mechanical change in the beginning of the session. I would have to provide a little bit more of fore milk, and for that I would have to really stimulate the stimulation, the milk ejection reaction for this to happen, to really provide the fore milk, and try to stay away from the hind milk because it has a little bit of more fat content. I like to think about it as a dessert for children because it has a little bit of more fat content. But yes, that's something that you can do. Another thing that can actually help is that, as Kenna told us before, human milk is like the homologous of blood. So if you can actually take as a mother a prebiotic or with a probiotic, then you will be able to provide that microbiome information to your children, to your baby, through your breast milk. So that's actually like a very good approach, and studies have actually shown that functions correctly. So I don't know if that fully answers your question.
Absolutely, it surely does, because I believe that laying down the right dynamics for the development of a child will later on influence disorders. Now, these disorders could be such as even Alzheimer's. We see that brain and the gut are connected. Early development of your genetic biome determines the fate of the genetic biome. So what we need to know is that we have issues like fibromyalgia, which we're going to be discussing next week, that are directly related to the gut biome. And in these situations, what we've noticed is that early developmental preparation of the body and the natural biome at an early stage develops a child that can also kind of develop in the right way to protect a more optimal immunological response. And that's important, that we understand that we're taking this story into adulthood, but we got to begin in one place. So yes, it did help. Thank you. Continue with your dynamics, because I know you're going to talk about a little bit of different subject matters in terms of the presentation there. Go ahead.
Okay. And well, you were really talking about everything that goes hand in hand with the immunomodulatory effects of breast milk. So I think that one of the most important nutrient components inside breast milk is protein, because it contains a lot of biomolecules and bioactive molecules. So we know that they are over 400, and we have not been able to fully determine their use or what they are able to do in a human body. But the few ones that we know about are like very important for our function and for our well-being and for the for actually the decreasing of the growth of several bacterial strains like pathogens. I mean pathogens by that. So yes, actually what I like about the breast milk protein content is that most of the times it's not actually used as energy, like just to provide energy. It actually has a lot of activities in that sense. So the first of all is that it can provide enzymatic effects such as lipase. Lipase is something that we can't be able to provide our children if they don't have breast milk. So this is very, very important because as we said before, 50% of the, well, I don't know if we said the full number, but 50% of the content of breast milk is lipids. So if you do not have lipase for that lipid content to fully metabolize and fully utilize it, then what are you doing with the lipid content of your breast milk? And that will eventually lead to gastrointestinal problems and diaper problems for your baby. So yes, that's something that can actually take us all the way from the milk functions to how you want your life to be in, if we're talking about diapers. So yeah, that's really important. Another thing is that it provides protection against infections. And of course, it has a lot of immunological purposes, I mean. And this actually talks a lot about the immunoglobulin A, or it's actually called secretory immunoglobulin A, which is like the immunoglobulin that is most commonly found in human milk, and it's very important for baby's development. So another thing about the protein is that it actually changed, and this is like a constant with breast milk. It will always be changing because it actually depends on the amount of time that we're going to provide lactation breast milk to our babies. So for example, if we talk about the whey and casein ratio, we will see that in the beginning or in early lactation, this whey casein ratio will be around 90 to 10, and then it will grow, it will change eventually to 60 to 40 in mature milk, and in late lactation, it would be like 50-50 casein and whey. Well, whey and casein, if you would like to see it that way. And this is something funny because whey has the ability or provides a lot of major components if we want to talk about the immunological part of breast milk. So it provides alpha-lactalbumin, albumin, lactoferrin, immunoglobulins, and lysozyme. And this is very important. So something else that you would like to know about protein is that I already talked about it being very, very good for baby's digestion because it carries the enzymes that will help digest the lipid component of breast milk. But another thing is that while it is comprised of whey and casein, whey actually provides a lot of the immunological factors that we want to talk about right now. So lactoferrin, I think that this is kind of self-explanatory, but there's something very important to know about this iron binding protein. You might think like, well, if I have a child, I wanted to have high iron concentrations, and that's not true because iron is actually it's actually considered food for some kind of pathogens or for some pathogens such as E. coli. So this is very important to know. So actually what happens is that I like to think about the protein section or about this whey protein sections as they are always competing. So lactoferrin competes against E. coli for the iron, so it won't it don't goes crazy and grows and increases its concentration. So that's exactly what we want to have. We want something that could protect our children against this infection. So it actually works against E. coli and Candida albicans. So this is really, really important for me. And it is actually really abundant in human milk. So that's actually something that you want to know. Another thing that it's really important for us to know is the protection of alpha-lactalbumin. So this is actually, as I told you before, is another part of the whey protein components. And there have been a lot of studies about alpha-lactalbumin, and they have to work hand in hand with the lipid components of human milk. Maybe we haven't gone through the lipid content of human milk yet, but in human milk we can find oleic acid. And when this alpha-lactalbumin binds to the oleic acid, it can actually form a complex that it's called Hamlet. So it stands for alpha-lactalbumin made lethal to tumors, and it can actually scavenge or find tumor cells or bacterial cells and kill them. So what else do you need? That is actually something very useful, and that actually shows that, I mean, you need to have the full set of human milk. You need to have the lipid content of human milk. You need to have the protein content of the human milk, and you need to have the carbohydrate content. It needs not only just energy, it's actually function. So for me, that speaks volumes, and it's very important for me. And oh man, I wish I was breastfed. Man.
I'll tell you what. We're learning today that the subject matter, and again, this is part one of our program. We're going to begin a much more elaborate breakdown of breast milk and the breastfeeding dynamics. As we see, it may, as I indicated in the beginning, not be something that appears to be related to the musculoskeletal system, but we're going to wind it there. We're going to understand how it later affects the child in the future. If there's one thing as a parent we want our children to be, is to be better developed or to be able to prepare to deal with the dynamics of the future as the child develops. So in our dynamics, we will discuss genomics, we will discuss nutrition. We're going to discuss the what we call the SNPs, or the single nucleotide polymorphisms, that Kenna will be discussing. We're also going to be discussing, things that are kind of correlated to this in terms of the length of time of weaning, which was very critical, the types of bacterial I guess, inoculation, and the dynamics of the development child. As that happens, it does have a direct implication as to what happens to that individual in the musculoskeletal arena, along with the organ functions of that individual. So we're going to understand how leaky gut can begin at the earliest stages of sometimes not be eradicated, just depending on the diet. If the child is not given a level of immunoglobulins that is strong enough to sustain the child's growth, it will change. So we're learning a lot, and this information is going to be brought to you by us as we get it, so that you guys feel that there's a greater level of awareness for you. And there are going to be questions, and for that we are always available. Call the numbers that are presented there, and we're going to be a team here to help you. So I want to thank Kenna. I want to thank Anna. It's a marvelous presentation. You can see that we can go on for a long time, as you can tell. Yeah. So what we want to do is we want to leave it there, and we want to continue the conversation and segment these nutritional conversations so that we understand how it affects the individual later on. Because a lot of times, just like Anna says, I wish I would have had that. Well, we want to give new moms the awareness that we have today present, to give them the dynamics that they can change a lot of the path of their physiology and the biophysiology and the biodynamics and the biochemistry of their children. So I want to thank you guys both for being part of this thing. And as we get that, we'll develop in a much more dynamic place. In today's world of Zoom, we can kind of communicate in ways like this, and it's going to be fun for what we do. So Kenna, thank you very much. Anna, thank you very much. And we'll leave it there, and we'll bring this on as we go for the future, and we'll bring it to a next level. So we look forward to having you guys have a wonderful day. Thank you, and look forward to hearing you on the next one, guys.